Hi, my beauties. I'm Dr. Stephanie Capel, and today I'm going to be talking about acne. So the reason why I want to talk about acne is because there's various forms of acne, and it happens in people of all ages, not just teenagers or adolescents. It can even happen in adulthood, and it's something that I commonly see as a dermatologist on a day-to-day basis. So there's various forms of acne. There's acne vulgaris, there's acne fulminans, there's acne excoriae, there's acne rosacea, there's hormonal acne. There's so many different types, but acne vulgaris is the most common type of acne. And that's when you have the little bumps, the red bumps, the whiteheads, the blackheads, the pustules, and even the cystic-like lesions that sometimes, if they're not treated appropriately, can cause acne scarring, which can be a lifetime skin problem that usually requires lasers or peels or resurfacing later on in life in order to treat. So it's an ounce of prevention is worth a pound of cure. If you're young and you're in your adolescence and you have acne, it's important to have your parents take you to see a dermatologist so that you can actively take a preventative approach to scarring, because once scarring occurs, it is hard to reverse. It's possible to reverse, but it's a lot easier to treat acne when it's in its early stages versus letting it just happen and scar you later on in life, which can be a lifetime problem that you have to struggle with in your 20s, 30s, and 40s and beyond. So the best way to prevent acne is honestly just cleaning your skin twice a day. This is especially important before going to bed at night, washing off your makeup, and after working out. So a lot of us just incorporate working out into our daily activities, and we'll leave the gym or studio and not go home right away and wash our face and shower. If that's the case, it's always important to bring some like complexion renewal pads by Zeo Skin Health or some type of swab or makeup remover to kind of remove all that dirt, oil, and debris that can accumulate during workout, because once it sits on the skin, it can increase acne lesions by increasing inflammation, clogging the pores, and causing proliferation of the P. acnes bacteria, which is the acne-causing bacteria. And the reasons for acne, it can be multifactorial. It can be genetic, it can be inherited, it can be your ethnicity, it could be your habits, it could be your dietary intake of dairy and different hormones, it could be your environment, the humidity in the air, travel. There's so many different things that can affect the skin and cause acne that it's important to kind of know what your personal triggers are and how to avoid them to prevent acne from forming or getting worse. So what the cause of acne usually is from the sebaceous gland, which is the oil gland in the skin. And as your skin just matures and goes through its daily exfoliation, the skin cells are, which is in the stratum corneum, the uppermost layer of the skin, they're dead skin cells, which are keratinized. That just means that there's a lot of protein, and the skin cells are essentially dead and they get sloughed off. But what happens is in the pores, which are connected to the hair follicle by a channel, which we call the follicle, a hair follicle, sometimes those dead skin cells that are migrating through the pore up into the skin can get clogged. And once that gets clogged, it's like having hair caught in a drain. The oil and sebum that's produced has nowhere to go, and so what does it do? It expands under the skin and causes a red bump. Then what happens is it can cause immune cells, which are the white blood cells or leukocytes, under the skin to come and accumulate in that area, and that causes a whitehead, or what dermatologists call a pustule. And then if it gets even more severe and usually hormonally activated, then it becomes a cyst-like lesion. And that's when you get those painful cyst-like lesions or acne bumps over the jawline in the T-zone that can cause scarring. So it's true that dermatologists always say, don't pick your acne, which is called acne excoriae, which can cause scarring. But even for people who don't pick their acne, it can still cause scarring, which can be really deleterious to the skin and have disfiguring scarring that requires for the treatments later on in life to reverse or to mitigate. But the most important thing to know about acne is cleaning your face twice a day is really important. Also exfoliating regularly, because an exfoliating polish or an exfoliating scrub is going to remove all those dead skin cells, deep clean those pores so that clogging of the pore doesn't happen, and so you don't get that inflammation or the recruitment of your lymphocytes or your white blood cells to the area, or it won't increase the proliferation or growth of the P. acnes bacteria. So these are all important components of acne, and as we go through adolescence and puberty, the hormones fluctuate during, our menstrual cycle. They can fluctuate during perimenopausal pregnancy, breastfeeding. Hormones can always fluctuate, and that's why our acne can either get worse or less worse or be cyclical, or just sometimes it's always a static kind of consistency where somebody always has acne. So depending on the kind of acne you have, your dermatologist can appropriately evaluate your acne to see what type of acne you have, whether it's in the form of whiteheads, blackheads, red inflammatory papules. Is it along the jaw? Is it in the T-zone? Is it cyclical with your menstrual cycle, or is it just kind of a static state where you're always just kind of having breakouts and it doesn't really get better or worse depending on the time of month? These are all important informational pieces that when given to your dermatologist, he or she can prescribe an appropriate regimen for you. But it doesn't always require prescription strength topical or cream or gel or foam or even an oral antibiotic or Accutane, spironolactone. These are all medications that are prescribed, but usually a prescription is not even necessary. It's just getting into a good habit or regimen where you're washing your face in the morning and at night, especially before you go to bed or especially after working out. And I'm a big believer of double cleansing. Most board certified dermatologists are. So after cleansing with your cleanser, it's good to use some type of scrub to exfoliate and then some type of toner, usually one that contains an alpha hydroxy acid or a beta hydroxy acid to kind of decrease the P. acnes bacteria, decrease the sebaceous gland oil production, and decrease inflammation. This is of the utmost importance. And usually when people incorporate a healthy skincare regimen, you don't need the prescription strength antibiotics. You don't need the oral antibiotics or the topicals. So that's my best advice as a dermatologist. Just keep your skin nice and clean, and don't believe the old wives' tale where they say you don't have to wash your face, and washing your face dries it out and then you get more oily and then you get acne. Washing your face twice a day is one of the best things that you can do for acne. And I always encourage parents of kids with acne to bring them into a dermatologist and just nip it in the bud and treat it and be proactive, because our acne scarring, like I said, can be really detrimental, very disfiguring later in life, and it's difficult to treat. Although we do have lasers and peels and different treatments for acne scarring, again, it's better to prevent it before it happens. So other treatments for acne, including cleansing and benzoyl peroxide, is a great topical wash or just topical cream to use to decrease the P. acnes bacteria. Benzoyl peroxide is the only antimicrobial regimen or topical that can have zero antibacterial resistance. So sometimes different antibiotics like clindamycin or erythromycin placed on the skin can increase bacterial resistance, and benzoyl peroxide, I remember they even asked us on our board dermatology exam that benzoyl peroxide is one of the only acne antimicrobial agents that doesn't have the antibacterial resistance, which is a great one. So you do have to be careful though, because benzoyl peroxide can bleach your towels or your pajamas or your pillowcases, so make sure that you're drying off with a white towel so that you don't ruin your towels or your parents' towels. And so another important ingredient for acne and skincare and acne prevention is salicylic acid in addition to benzoyl peroxide. So you don't have to use both. Using one or the other is usually beneficial. Always using some type of retin-A or tretinoin or adapalene, which is usually now over the counter now. It used to be prescription strength, is great to do. Usually you apply this at bedtime. Sometimes at first it can cause a little bit of irritation. You can be red, dry, peely, and then your skin gets accustomed to it. But usually incorporating some type of retin-A, tretinoin, adapalene, or Tazrac at bedtime is often really beneficial for acne. It also has anti-aging effects, but it's important for acne because it regulates the follicular pilosebaceous unit, which can contribute to acne. So these are my tips for avoiding acne and the different types of acne, and knowing that it's important to go to a dermatologist to assess the type of acne you have, and just simple things to keep acne at bay, including washing your face twice a day and exfoliating and using toners and AHAs and BHAs to keep the acne under control. Hope this helps you guys.